What's been fascinating about the Getting Further Faster initiative is it's really illuminated the importance of coalitions coming together to address what we call the social determinants of health. Really the contextual factors of where they live and eat and worship and pray. And I think that it's perfectly well suited to what health departments do. We see them as community health strategists, as individuals who bring expertise, they bring partnerships, they bring science of public health to be able to support community coalitions to really advance and address those contextual factors. We've learned across time that it's not just addressing the results of bad environments, but we need to really change structurally those environments themselves.
We have to have a holistic approach to be able to ensure that everyone has the opportunity to live a successful life, to live a life of joy and happiness. At the end of the day, everything is connected. Education, housing, food insecurity, wealth inequality, financial need, safety and belonging, mental health, all of that comes together.
It all comes back to how you nourish the body. Food nourishes the body, but it also nourishes the mind. You can't have pride if you're always taking handouts. People want to be able to sustain themselves. They want to be able to have the pride and the dignity to either have grown food themselves or to be able to be in a position where they can afford it.
Proviso Partners for Health has been in this community since the early 2000s doing this food justice work. And so a lot of these partnerships have been cultivated and strengthened over the years. Not just distributing food, building opportunities for people to get jobs, start their own business, spark their entrepreneurial spirit if they're interested in the food industry, to support local foods here in Maywood.
I started Finding Justice, a flower and vegetable garden, because we live in a food desert. We don't have access to fresh, affordable produce, and after I created an access point, we started to understand that there was more of a need for education as to why to eat the vegetables. So our program now includes education as well as access, just to increase longevity amongst us all.
We intentionally purchase from women, Black and brown farmers and people of color in order to support more food equity in the Chicagoland area.
Another thing which is even more important is that a lot of people who have participated feel like they're finally being seen. So people in the community have felt ignored, that no one cares about them having the opportunities for health. There's a lot of assumptions that maybe members of community don't want these things or don't care, but really it shows that we do care. And I think people feel like, wow, programs like this make us feel like we are truly valued. And it's just a small start, but it's a start.
We just got a text message on Friday that a participant who opened his box and he said, I haven't been able to buy strawberries in a really long time. So when I saw strawberries, I almost started crying. Thank you to you and your team. And we don't think about that all the time, that this is a treat for some people, and it really shouldn't be. This should be normal intake for people. And many of the people that are part of our program have been with us since we started back in 2017. So we've really gotten to know everybody. They know us, they trust us. They call my team asking for other services, and that just shows that if somebody has an issue with food access, they probably have other needs as well. So we've become a trusted source, I think, in the community for people to seek out that help.
Even though we focus on health, we focus on sustainability and housing, we focus on how to make sure that people can start new businesses so that there is health and wealth in the community, so that they're not just a group of people bringing in, imposing their ideas and new programs to bring a grant in that only lasts for a season. We want people to be able to have programs and sustain them and be able to be self-sufficient in themselves.
It has been said from the neighbors and the people that walk around this neighborhood that see me out here every day, dedicated in the sun, the heat, the rain, the cold. It's tangible that it can be done by anyone. We teach that it's not difficult. You could literally take a bell pepper from the grocery store, take the seeds, put them in dirt, and grow it yourself in a windowsill. But to see someone that looks like them doing this every day, they're curious. And just one piece of curiosity can just grow into something very great.
In the past, healthcare only existed within the four walls of hospitals and clinics. And finally, healthcare providers and systems are realizing that it's so much more than that.
Health doesn't mean just physical health. We mean health of the community, health of individuals. We mean mental health. We do a variety of things to make sure that we're not imposing on the community, that we're looking at actual community needs and providing what it is that the community says they need and not just what we think they need.